1 minute.
Yeah, you're good. Thank you. Good afternoon. This time we'll begin the COVID-19 public briefing. Today is Thursday, August 5th, 2021. My name is Brian Beam. I'm the parish administrator here in Calcasieu for the Calcasieu Police Jury. It's been a long time, I think, since we've had a public briefing on COVID, which has been good. Unfortunately, I think we know why we are having one today. The Delta variant of the virus is showing its full impact throughout this whole country. And unfortunately, Louisiana is one of the hardest hit. We're going to learn more about that with some details later. But it's very important that we try as local officials, and you'll hear from some of them later, to try to help as much as we can rid this area as best we can of this very insidious problem. We're going to focus mainly today and hear from many local medical providers. We're very appreciative of their time, and you're going to hear directly from them their views on how we combat this the best. In a moment, we're going to start, however, with Dick Grimion, our Emergency Preparedness Director, who's going to give a few highlights of the Governor's executive order update from earlier this week, mainly regarding the mask mandate. He will be followed by Region 5 Public Health Director, Dr. Lacey Cavanaugh, and then she will introduce the local physicians we have here today who are speaking. So at this time, I'd ask Dick Grimion to come forward.
Thank you, Brian. On Monday, August 2nd, Governor John Bel Edwards issued a proclamation regarding the wearing of masks. There's a lot of wording in the proclamation. You can go to the governor's website and read all of the details, but I just want to hit the essential part of this. And it's Section 3, number A, all individuals in the state of Louisiana shall be required to wear a face covering over the nose and mouth when indoors, any place outside of a private residence, except for circumstances provided in Section C below. And as I said, you can go to the governor's website and see the details of what those exceptions are. One of the big ones is, for people who have to wear them, is public transit. So just about every public transit mode that you can think of, you will be required to use a mask on those transit. You're going to hear this probably from the physicians today, but just a preparedness message. Remember to wear your mask. We're all wearing ours out here. We're taking them off to speak to you today. Make sure you wash your hands very well. We're going back to the stricter hygiene advice. Cover your coughs at least with your arm or cloth if you have it. And maybe the most important thing is maintain that 6-foot space between yourself and others if you can manage that. If you're not able to maintain the 6 feet, it's recommended that you wear a mask. And with that, I will turn it over to Dr. Cavanaugh.
Good afternoon, everybody.
Dr. Lacey Cavanaugh. I'm a family physician by trade, for those of you who don't know me, and I'm also the Regional Medical Director for the Office of Public Health for Region 5 here in Southwest Louisiana. I'll say that being here today, giving this briefing, is not where we wanted to be. It's disappointing, it's sad, but here we are yet again for, so many times that has happened this year that we are in crisis. We can either choose at this point to stick our head in the sand and pretend like this crisis doesn't exist because, we don't want to be here, or we can go ahead and tackle it with the tools that we know work to control the spread of COVID-19. Right now, our hospitals are taxed. Entire floors that would normally not have to take care of COVID patients have been converted to COVID wings. Our nurses are working overtime and double shifts to cover. People who haven't been on the clinical side of medicine because they've been administrative are being pulled in to take care of people because we are in crisis right now, whether we acknowledge it or not. When I think back over the events of the past year, I think back to Hurricane Laura. And I'm sad to report that today, on August 5th, 2021, we have fewer hospital beds, both ICU beds and floor beds, available in this region than we had on August 28th of 2020, which was the day after Hurricane Laura came into this community and devastated us. That was in the midst of a time when we had no water, we had no power, we had hospitals that were requiring evacuation, and we have a more fragile infrastructure today than we had even then, which is, very disheartening. So today I want to share with you the facts that we have, the statistics about where we are in this battle against COVID. And then I'm going to ask some of our community physicians to come up and speak because we need your help to get this pandemic under control. It's not going to be won, this pandemic, the war against COVID-19, is not going to be won by me or by any of the speakers in this room today. It's going to take everybody in Southwest Louisiana really listening to the message that is coming from our medical community and take action to care about each other. So some facts. 127 people are hospitalized today in Region 5 from COVID-19. And 15% of those are on ventilators. 91% of all the hospitalizations in Louisiana are of unvaccinated individuals. Look back only 2.5 weeks to July 18th of this year. We only had 23 people in the hospital for COVID in this region, and we only had 5 people on ventilators. So from 23 to 127 people in our hospitals in Region 5 in only 2.5 weeks. Today, we have 2 ICU beds available in Region 5, and neither one of those are in Calcasieu Parish. Hospital bed shortages are definitely becoming critical. We have 144 new cases of COVID-19 in Calcasieu Parish that's reported today. And of course, we know that that's a small fraction of the total number of cases because there are many people that can buy tests over the counter and test, and so those may not be reported. Also, we know there are lots of cases that don't test for many reasons. We have 46 cases in Beauregard, 20 in Jeff Davis, 23 in Allen, and 2 in Cameron, for a total of 235 cases here in Region 5 that were reported today. We're averaging over 1,000 new cases a week in this region. And 1 month ago, compared to 1 month ago, that's up 600%. 90% of those cases are also unvaccinated. Only 27% of our region here in Region 5 is fully vaccinated, meaning that they've received 1 J&J shot or 2 of the other 2 products, 2 doses. Southwest Louisiana is last in the state of Louisiana and our percentage of the population that's vaccinated. And Louisiana is 47th in the nation with the percentage of the population that is vaccinated. And Louisiana is also first in the entire nation in the number of new cases per capita, and second place is not even close. These are the facts for your home, the place that you live, the place that you raise your family, the place that you go to work. So just keep that in mind. So as I said, the medical community needs your help. We need you to wear a mask. We need you to stay away from other people. We need you to avoid crowds. We need you to talk to your doctor about taking the COVID-19 vaccine. We have 4 physicians that have taken time out of their day to come and speak with us today. This is time away from busy clinics and patients who are sick. Remember that physicians have a unique training. Every decision we make in medicine is looking at a risk-benefit analysis ratio. Every surgery that's done, every medicine that's prescribed for your diabetes, every procedure that you have, they all come with a certain degree of risk, and we are trained to look at all of the data and look at the risk versus the benefit and help patients to determine what the right choice is for them. So this takes years of training and really a lot of critical thinking. You put your lives into the hands of doctors every day, every time you have a surgery, every time when you have cancer, when you have diabetes, when you have high blood pressure. You put your life into the hands of our medical community and you trust them. So I'm asking you to really listen to them today. Listen to the message that they have to say. It's too important not to listen. So we will start today with Dr. Clifford Colville. He will come up and introduce himself. We have 3 additional speakers to follow. Each will come up, give their background, and talk a little bit about COVID-19. And then at the end, I will return to the podium to answer any questions that you may have of me. Thank you.
All right, thank you, Dr. Cavanaugh. My name is Clifford Colville, and I'm a pulmonary and critical care doctor at Lake Charles Memorial Hospital. And as Dr. Cavanaugh stated, it is rather disappointing and discouraging to be giving the same lecture, the same bit of information that I provided almost a year ago today. A year ago today, the ICUs were full. We were putting 2 patients to a room. And here we are today. The COVID ICU at Memorial is full. We're putting 2 people to a room only in emergent circumstances, but as of now, it is full. The major difference as compared to last year, well, there are a few differences. One is that there is a way to prevent that, which I'll get to in a moment. The second difference is that the dynamics and the demographics have greatly changed from last year. There's been a lot of talk about people being low risk and therefore they don't want to get the vaccine. They've talked about COVID typically affects those that are more fragile. And whereas a year and a half ago that may have been true, now that is not what we're seeing. As of right now, the majority of people in the ICU are under the age of 60. The majority of people on ventilators and life support are under the age of 60. There's a 25-year-old on high-flow oxygen. There are 40-year-olds on the ventilator. These are people that look like people in the community. You see them working. These are people just like you. The other big difference compared to last year is that there is a way to completely prevent all of it. I feel like, and this is, I speak for myself and my partners and others in the COVID ICU and other healthcare professionals, that we've been running this race, really more of a relay where we've been handing the baton off to one another, really trying to buy time for something to be done to end this pandemic. And we've made it through wave after wave, hoping that the peak would plateau before the next wave. And we've finally made it. And there now is a way for this race to end. Except in order for this race to end, I have to hand this baton off to everybody else in the community. And yet 70% of the people in this community will not grab it. They say, I don't want it. When I talk to people in my clinic, when I talk to people in the grocery store or just elsewhere in the community, they say, not me. Well, this race will not end. Now, I will continue to carry that baton. We will continue to do so indefinitely, as long as we have to. But we're pleading for you to please help. There will not be an end. It is miserable. It's miserable for everyone. It's miserable for the people that are dying in the ICU, whose lives are ruined by becoming critically ill. It is miserable for the rest of us, for the children that have to wear masks. It's miserable for the people who can't go to grocery stores or restaurants. But there is a way to end it. Yes, COVID for many people is low risk. They might be low risk. but there is a way to make it no risk. And that's what we're asking you to do today. I'll now pass it on to Dr. Noble, a very familiar face and well-respected individual. Thank you.
Thank you and good afternoon. I'm Dr. John Noble. I'm an orthopedic surgeon from the area, and you might wonder why an orthopedic surgeon would be talking about this issue. I don't treat very ill patients, fortunately, but I do treat well patients. But when our hospitals are full, we have no capacity to treat those well patients. So as somebody who performs a lot of elective procedures, we now believe that there's a high likelihood that those elective procedures will need to be postponed. I've spoken to my colleagues all across the state, and this is not something that is isolated to Calcasieu Parish. New Orleans, Baton Rouge, Monroe, Shreveport, all of them have seen an explosion due to the Delta variant, and this has made them postpone or completely stop elective procedures. The other thing that's very important is that if a patient has a heart attack or a stroke, or God forbid is involved in a bad car accident, we do not have the resources to take care of them. We don't have hospital beds, we don't have staff, and so if we're going to slow down the spread, I think that one of the things that has to happen is that we have to consider vaccinations. I want to reiterate what Dr. Cavanaugh spoke about in terms of wearing masks and in terms of social distancing, but my opinion is this, that we can stop this pandemic through vaccination. This has unfortunately become a very political issue, but it really should be a public health issue, not a political issue. So it is my opinion that these vaccines are very safe, and I would strongly recommend, if you're eligible for the vaccine, communicate with your healthcare provider, and if you can get the vaccine, please do it. The 3 vaccines that are readily available have all been shown to be very safe, and as Dr. Colville was talking about risk-benefit analysis, clearly the risk of not getting a vaccine is much greater than the risk of getting a vaccine. So thank you very much, and please help us work toward controlling this terrible pandemic.
Good afternoon, everyone. My name is Cameron Shahid. I'm a medical oncologist. Basically, I'm a cancer specialist treating cancer patients in the community. I never thought I would be here talking to you all about an infection. But what is worse than cancer? If you have seen or noticed a person who dies of COVID-19 respiratory failure, you will know the answer. While my colleagues have talked about getting vaccinated and doing all the stuff which we need to do to make sure we eradicate or stop this spread of COVID-19, I just want to talk about the vulnerable people. As a cancer doctor, I see people who die every day. They are immunocompromised. If they are around people who have COVID-19, their chances of surviving are much lesser as compared to the other population. So we are here to talk to you about something very important. I know you have a duty at this time to help your vulnerable population and to spread this and to stop the spread of this menace as soon as possible. The more vaccinated our numbers are, the more vaccinated our people are, the better it will be for those people. So we strongly urge everyone to talk to their doctor about vaccinations, wear the mask, and spread and get rid of this altogether. The sooner we do this, the better it will be in fighting this pandemic. Otherwise, unfortunately, we are going to see many deaths just because of COVID. And we will feel bad because this is something which could have easily been prevented. All what we are asking for is wearing a mask and taking those steps to stop the spread of COVID-19. I want to again reiterate what all my colleagues have told you about, and I hope that this message will be taken seriously. Thank you very much.
Good afternoon. My name is Dr. Amber Dawson, and I'm an internal medicine pediatric specialist. And I'm here to talk to you, of course, about COVID-19 and the fact that we're seeing younger patients come into the clinic with symptoms of COVID-19 as they're not getting vaccinated. They'll come in, it's not always the same symptoms. Some of them will have very vague symptoms, but a lot of them will say they have loss of taste or smell, and they will most of the time be positive for COVID. We're seeing it in children as well now, and there is a COVID-19 vaccine, the Pfizer, that is approved now for children ages 12 and up, and I recommend, especially since school is starting, for all children to be vaccinated. The vaccine is shown to be 100% effective in the ages 12 to 15, and I believe there are increasing hospitalizations for the pediatric population as well for COVID-19. And the thing is that everybody can spread this virus, and children can spread it to their family members and vice versa. So, like I said, I would recommend everyone to get their vaccine. A lot of my patients mainly say that, we don't have the research. I haven't seen a lot of research. I haven't read about the research. So I tell you to look at scientific or medical journals. Don't just look at any website. Look at NIH, look at cdc.gov, and you'll get all your answers there. So I do recommend, again, that everybody get this vaccine. Like I said, especially in children or anybody, that's what we have vaccines for. In children, we don't see as many, well, rarely we see any polio or diphtheria. These have become rare diseases because of vaccines. Currently, the only thing we have against COVID-19 that is effective is the vaccine. And again, I recommend masks as well, and if everybody can be safe. And this is not just for yourself, but for everyone around you that you're getting vaccinated. So, thank you.
Thank you. I will take questions now.
Hi, I'm Mike Smith from The Advocate. The message has been, everybody's sort of been sending the message about vaccination for a while now, and it doesn't seem to be getting through. Although statewide, I know we've seen a pretty good increase in the people getting vaccinated. What can this region in particular, you think, do to get more people to get the shots, considering it is the lowest in the state?
I think that at this point, we are seeing big increases in the number of people who are getting vaccinated in this region. I do follow that metric on a regular basis, and those numbers have gone up significantly compared to a month ago. So we are on the way. Vaccines are available now in many places and spaces. They're on almost every corner in every pharmacy and clinic, many clinics. So they are widely available. So we know that it's not just an access problem. I think from this point forward, This is where we get down into discussion with people. This is where we talk to individual people as, physicians and talk to them about their situation and the risk versus the benefit. So I don't think that this battle is going to be won here in this public space. I think it's going to be in doctors' offices and pharmacies in consultation with all of our medical community, in a relationship where people trust their doctor, their provider, or their pharmacist to give them good advice. So.
Because I heard from somebody today, for example, who was very concerned about hospitals not requiring staff to be vaccinated, especially people who are maybe older and have to get treatments regularly. I know there's lots of legal arguments that have gone on about that. Do you think that should happen, or what should be done? Because I think there was a story today where one hospital had something like 40% of staff vaccinated, which was kind of shocking to me. But do you think something should be done? Because they're also setting the example for people, I guess. Should something be done should that be required, or should something be done to sort of encourage more hospital staff to get vaccinated?
I definitely think many hospitals are working very hard to encourage their staff to be vaccinated. You have seen some major hospital systems across the state already put out statements that they are going to require vaccines. Others have not. That's going to be an individual decision by the hospital leaders in that community. But, I do think that there are precedents for vaccination. Healthcare workers are required to get a whole lot of other vaccines, including Hep B, and there are ways in some cases to do exemptions for that. You're right that this is very involved with the legal system, so I don't know what's going to happen in some of these cases, but I know it is a big discussion topic. But whether or not it's mandated, I certainly think that every hospital is doing a whole lot to work with their staff to try to encourage vaccination.
Yeah, I know that we talked a couple days ago, but maybe just for people, if they're watching this, if they want to get a vaccine, where can they get it? What are some of the resources that you can tell people that haven't got it yet, that may be wanting to get it now, maybe they've had a change of heart? Just to get that update real quick.
Sure. So we do have a vaccine hotline. You can pull up the number on the LDH website, and they can connect you to the nearest vaccine center to you. We also can provide information via 211 to find vaccine sites. All of our health units across the region are also providing vaccines. We have a drive-through site at our Calcasieu Parish Health Unit for those of you who live here, so people can drive through Monday through Friday. I think the hours are from 8 to 2 without an appointment or anything. Many pharmacies provide vaccine, and on the LDH website, there's a list. As a state, we have over 1,400 available locations on a week-to-week basis. It fluctuates slightly week to week, but there are many, many, many spaces that people can get vaccinated or call if they're not sure where their nearest location is.
Maybe just real quick, I spoke with Nick Hunter yesterday, and he put that video. The city put that video out with Dr. Wallace, kind of trying to dispel myths about about the vaccine. Obviously, social media is there's a lot of misinformation, or there's a lot of things out there that people are posting that may not be accurate. I don't know if you want to comment on that at all, as far as how we combat that, or what medical professionals are doing on their end to try to make sure that people are getting the facts and not something that's inaccurate.
Right. It is definitely very difficult, and there is a ton of misinformation on social media. So, I just encourage people, to not get their primary source of information off of social media and to talk to their doctors. Mm-hmm.
That's okay. Okay, so I guess the question is, because it was brought up just a few minutes ago by one of the physicians, about politics, about it being political. So what do you have to say about that for the people maybe who don't have the information or think that this is a political stunt?
Yeah, it's definitely not. COVID does not discriminate based on politics. COVID is everywhere. It can infect anybody and it can kill anybody. So, I hate that it has become so political, but unfortunately, it's the reality and it's the world that we live in. And I encourage people to not pay attention to that side of it and to, once again, listen to our medical professionals, because our medical professionals, usually are not involved in the political realm at all.
Thank you.
Yeah, I was just going to ask, because we've seen examples of some hospitals giving incentives, like paying people $100 to get vaccinated. What do you think about that? Do you think more hospitals should be doing that? I mean, I guess there's also the downside where you're rewarding people who kind of irresponsibly waited, but what do you think about that?
I think that right now, whatever is effective to help people get vaccinated to get us back to normal is what we need to be doing. So the most important thing is to get people vaccinated. So,
And then I do have another question. So can you kind of bring back up the number of ICU beds? Because we don't have any available in Calcasieu Parish, and so that's very concerning. So can you just kind of really go back over that real quick?
right. So it is extremely concerning. It is, gravely concerning. I don't know how else I could state it, but I mean, it's a big deal. When you think about what the impact is of no ICU beds available and how many other conditions outside of COVID-19 that can impact. You think about trauma in particular. You think about heart attacks or strokes that require, ICU level care. And it's definitely not ideal. It is not a good place for our community to be in when we do not have that resource. All right, I think, is that it? Oh, does anybody else have anything to add? Any of our other physicians to any of the questions?
Dr. Cavanaugh, could you comment on the success of the eradication of smallpox and polio?
Sure, repeat that one more time in the mic so that.
Would you mind commenting on the eradication of smallpox and polio and what a great public success that was?
Absolutely. For anybody who may remember when these diseases ran rampant in our communities, a lot of people died, and we have been successful through vaccination. Vaccination is what has made it possible for us not to have to worry about those things anymore. It is one of probably the biggest, public health successes that we've had. Actually, as we have learned how to control infectious diseases better until COVID-19, our life expectancy as a society had increased largely because we could control infectious diseases. So that is why it is so disheartening to be in this space. It is definitely preventable. All right, I think that's it. Thank you so much.
Thank you, Dr. Cavanaugh, and to all the other physicians. These are very wise words you've heard from people who know what they're talking about. They see this every day. It's very interesting to hear the different aspects, and I appreciate Dr. Cavanaugh reaching out to the different disciplines, because the effect is not always just direct. It's the indirect that affects us all, as well as the direct COVID. The field of public health is wide and deep. And what I mean by that, when it comes to public policy and execution of that policy, in Louisiana, we're actually different from most states. That is, at the state level is the Department of Health. And a department within that is the Office of Public Health, which Dr. Cavanaugh oversees here in Region 5. So historically, I think we've probably done a disservice to our folks that say, well, the state handles all that, but it's just simply not true. We all have to deal with that. And at the local level, in this case, the parish, the 6 cities in our parish, and even law enforcement, because we've got mandates that have to be enforced, we are all involved in that. And although it is really important, and we're so glad the focus is from the medical community, we do want to hear from some of our elected officials, and we talk regularly. We had a meeting earlier this week, police jury president, the mayors, the sheriff, on this issue, and we're all part of that public health service delivery system. So we would like to take a moment to hear from some of them. We'll start with Brian Abshire, who is the president of the Calcasieu Parish Police Jury.
Thank you, Brian. I'm here alongside other local officials and various medical professionals that serve our local community. These are not just medical professionals, but leaders in our community that contribute well beyond their medical practice. These are doctors and people that we have trusted for many years. I could stand here and tell you what we've been hearing and repeat everything that you've already heard. I'm not a doctor, so I can't go into detail about the effects of the virus, although I can tell you I've been vaccinated. My family's been vaccinated. My children have been vaccinated. I want to get rid of a mask. So I ask everyone, please do your part and get your vaccine. I'm glad that these local doctors are here and eager to share their knowledge and provide some insight to those of us who don't necessarily understand. They've studied and have for years and are qualified to give this type of advice. At the end of the day, what's easiest is just to talk to your local physician, get their advice, and please take their advice. Get your vaccine. Do your part, and let's get back to normal in Southwest Louisiana.
Thank you, Brian. Appreciate the comments. We'll hear next from Mayor Nick Hunter, Lake Charles.
Thank you, Brian. Good afternoon, everyone. I get that people are tired of hearing politicians talk about this topic. And quite frankly, if my wife is not feeling well or my kids are not feeling well, my wife does not come to me and ask for advice. I have a history degree from McNeese, even though I'm representing Soella today, and I am not qualified to give medical advice to this community. But I will not, as Dr. Cavanaugh stated a moment ago, stick my head in the sand and ignore a lot of suffering that's going on in this community right now, specifically within our hospitals. Quite frankly, it would be easier for me to do that. It certainly would be less emotional and less stressful, some might say, to just ignore what's going on and not address it. But when my wife does feel sick, or if my kids are feeling ill, she may go on WebMD, she may do a quick Google search, but at the end of the day, I guarantee you my wife is calling the children's clinic, and she's wanting to speak with Dr. Stephanie Trimmy or Dr. David Wallace, and we're going to follow their advice. We're going to follow their advice. You know, we're very used to natural disasters, unfortunately. And I remember when Hurricane Laura was heading our way, the counsel from the meteorologists from the National Weather Service was absolutely crucial. I believe they saved lives with their counsel. We did not hear what they had to say and then go on Facebook or Google and say, thank you for your opinion, but we're going to go do our own research. We listened to them, and I believe we truly saved lives. And I know people in this community are frustrated. But when I hear individuals like Dr. Noble, who I've known probably my whole life, grandfather, ate at my restaurant when I was a kid. I mean, I've known Dr. Noble since I had hair. And Dr. David Wallace, who I spoke with yesterday, was my 6th grade basketball coach. When guys like that give me advice, I know it's the real deal. And while I can't give you medical advice, I can guarantee you that there is no sinister league locally amongst the medical professionals. There is no incentive to produce fabrications. There is no incentive to suggest a vaccine that they don't believe in. When you hear men and women within this local community who are medical doctors giving their opinions, I truly believe it is because they want to help people, and ultimately they want to save lives. Ladies and gentlemen, again, look, I'm in the restaurant business. The last thing the last thing that I want to talk about is masks or encouraging people not to get out and about within this community. But again, I simply will not stick my head in the sand. And I believe that we as a society have to think about not only today and tomorrow, but what's the next generation going to look back and say about us at this moment? You know, what are our kids and our grandkids going to look back and say about us at this moment? Are they going to look back and say, wow, they chose an easy path to do nothing, or they chose a hard path to acknowledge that this is real and acknowledge that there is a way out of it? And quite frankly, when you say a hard path, even Dr. Wallace's own words yesterday, I asked him, in your opinion, what's the end game? And he said vaccines. And truly, getting a vaccine in this city is not a hard thing to do. It's actually a very easy thing to do. But again, I will end my prepared comments by saying that I have tried, as of late, not to use Nick Hunter's voice to tell people to go get a vaccine, but to try to use my voice to say, I beg and I plead with you, go speak with your doctor. Go talk to your trusted family physician. Go speak with your trusted medical doctor. And you know what? At the end of the day, if for some reason that individual does tell you not to get the vaccine, I wouldn't fault you for doing it. But please don't stop with a Google search. Don't stop with a perusal of Facebook. Go sit down one-on-one and speak with your doctor and take their advice. That's the end of my prepared statements unless there are any questions. Okay? Thank you.
Thank you, Nick. I want to recognize there's two other elected officials here, two mayors in the parish, Mike Danahay of Sulphur, Bob Hardy of Westlake, are present with us. Don't want to put you on the spot, but if either of you or both would like to speak, we certainly welcome it. Any takers? I think they're here in support of the whole message that you hear everybody speaking of, and we do want to show our united support of this whole effort. This concludes our roster of speakers today. We do not currently have another public briefing scheduled at this time, but of course that depends on the need. And we take our cues from Dr. Cavanaugh, who is the central official here, who's got her finger on the pulse of everything going on. So if we need to, we will. But at this time, that will conclude our presentation. If there's any questions on anything that may have been overlooked, we certainly will take those at this time, however. Okay, we thank you for your time. And again, please heed the advice of all those you heard from today. Thank you.